Hello and welcome to our IPAC Back to Basics education series. Our series is meant to help those that are new to the world of IPAC and also be a refresher for those that may be feeling that they need one. In this module, we will be discussing personal protective equipment with a focus on donning and doffing. Here is a view of the modules that are available within the series. If you haven't already, you can begin with our first module, IPAC Concepts. Then move on to the other segments. In this module, we will discuss the importance of PPE or personal protective equipment. All modules are under 30 minutes in length. You can also locate them on our website or use this QR code to bring you there. Make sure to take your time completing the module and feel free to pause when needed, as this is a pre-recorded session. So by the end of this module, we hope that everyone will be able to understand what PPE is and why it is important within our congregate settings, explain each type of PPE and what it is utilized for, and confidently understand which PPE is required for additional precautions, and verbalize how to don and doff each type of PPE and the appropriate sequences. So on this side, we just have a QR code linked to the PHO and PDAC document that speaks about routine practices and additional precautions. So let's jump right into the main focus of this module, PPE. We will be discussing all the different aspects of PPE and our best practice recommendations for it in relation to IPAC. So why is PPE so important to IPAC and your congregate facilities? It is typically the last IPAC measure that is used when previous ones don't completely stop the exposure to an infectious agent. When you are going to be exposed to someone who has symptoms or a known infectious agent, PPE provides a physical barrier between your portals of entry, so it could be your mucous membranes, airway, or skin, to protect you, and the barrier also prevents you from becoming a reservoir or mode of transmission by covering your hands and your clothing. PPE doesn't replace the other IPAC measures in place. All other measures must be continued to be adhered to create a multifaceted approach to prevention. Too many times, PPE makes us feel like we have superpowers and we forget our other measures, such as keeping our distance when possible or performing hand hygiene. So looking at our chain of infection, PPE breaks the chain between the mode of transmission and the portal of entry. PPE, when worn and used appropriately, is that physical barrier that doesn't allow the agent to cross. Instead, it is trapped on the PPE that is then discarded or reprocessed. The selection of PPE is based on what portal of entry requires protection through determining the nature of the interaction, such as direct wound care or assisting with toileting as examples, and the likely modes of transmission of the suspected or known infectious agents. So it could be known COVID and coughing, or even known MRSA and direct wound care as examples. So personal protective equipment includes a variety of masks, eye protection, gloves, and gowns. Masks can be utilized for two different types of protection. Most commonly, masks are a form of PPE that covers your nose and mouth to protect your respiratory system, as well as some mucous membranes from droplets and aerosols and splashes and sprays. Masks can be used as source protection, meaning the person with the infectious agent or symptoms would wear the mask. This contains the infectious material and reduces the amount that is spread into the environment around them. There are many different types and styles of masks that can be utilized. Regardless of the type of mask, ensure the mask that fits your face snug and doesn't leave any gaps or holes. Most often, you will be required to have a medical grade mask or utilize an N95 respirator. Medical grade masks are the most commonly used masks in our congregate living settings. They are single-use disposable and have an ASTM rating of level 1 to 3. Most often, level 1 is sufficient for the type of exposure one would have. Higher levels are more often utilized for intrusive medical procedures, for example, surgery. These masks are typically one size fits most. However, utilizing different styles of ear loops, ties, or youth size will help ensure the right fit is for you. An improper fitting mask is similar to wearing no mask at all. N95 respirators are a specific type of mask that fits tight to the face so it filters the air more precisely and smaller particles are removed. The use of these are typically utilized for airborne agents or when aerosolized generating medical procedures are being used. More often or not, if an N95 is required, it will be posted with signage. N95s shouldn't be used unless you are properly fitted for one, which on minimal needs to be every 2 years or more frequently if the size of shape of your face has changed significantly. The use of these masks require a clean-shaven face. So let's get into some do's and don'ts of mask wearing. First and foremost, you should always clean your hands before and after touching your mask. This can be with alcohol-based hand rub or with soap and running water. You also want to wear your colors out, meaning if your mask has a blue side and a white side, the blue color should be facing out. This ensures that you are wearing your mask properly with the layers of the mask in the right place, such as the fluid-resistant layer being on the outside. Next, you don't want to pinch the band around your nose. It will create a gap. Use both hands to smooth the band over the bridge of your nose for a tight, smooth seal. Pull the mask down and under your chin. Don't allow it to rest on your chin or under your nose. That is not providing protection. Once your mask is on and fitting properly, try not to touch it. Infectious agents are on the outside and inside of it. If you need to touch it, perform hand hygiene. Don't let a dirty mask hang from your ear or arm. It can spread germs to other parts of your body. Now let's move on to some don'ts of mask use. When it comes to wearing a mask, we don't want to be touching the front of our masks with our hands. If we are frequently touching the front of our mask to adjust it, any potential pathogens that have landed on the front of your mask will now be on your hands, which can be then transmitted to others, the environment, or yourself. During the COVID-19 pandemic, we all probably saw a lot of misuse and incorrect ways to wear a mask, including under one's nose or storing it under your chin. Both of these practices do not protect your airways from the spread of pathogens. If you see others in your setting wearing masks like this, it can be a good opportunity to educate them on why we don't wear our masks this way, and the proper way to wear our masks to protect ourselves. And lastly, when storing your mask, ensure you are doing so in a clean space, such as a paper bag or disposing of it and getting a new one. Wearing a mask on your arm or hanging from your ear allows pathogens to attach to your mask, which you'd then be replacing back on your face to wear again, allowing for quick access to your respiratory tract as a portal of entry. So on this slide, we have linked one of our IPAC developed how-to videos, which explains the steps to putting on facial protection and having it fit properly. We have this video and many others on the TBDHU website that can be accessed through our QR code.
Eye protection. Eye protection comes in numerous forms, just as masks do. The main function of eye protection is to create that physical barrier to any splash or sprays from your eyes, which are a mucous membrane or a portal of entry for infectious agents. This picture here demonstrates the three main types of eye protection, being safety glasses, goggles, and face shields. It also demonstrates that prescription eyeglasses are not a form of eye protection. You can see here that they do not provide any protection. However, you can get prescription safety glasses or safety glasses that fit over your prescription glasses. You can also see here that goggles provide a tight fit to the face if there's going to be heavy droplet contamination, where face shields also protect your nose, mouth, or mask from becoming heavily soiled. There are a few other types of eye protection that are available, but this demonstrates the three main types and the idea here. Some do's of eye protection. When goggles are being utilized, ensure they have a snug fit and seal to your face. Ensure that all valves are in place. Once you're done with your eye protection, always ensure to remove them before you're exiting the room. Do not continue wearing them to the next client or common areas. Also know the product you are wearing. Is it disposable? Is it reusable? If it can be worn again, is there a special receptacle for reprocessing, or are you responsible for the cleaning and disinfecting? Also know the correct process for this. The don'ts of eye protection. Again, prescription eyeglasses cannot be utilized as eye protection. Just like masks, once the eye protection is on and a good fit, try not to touch them again because the outside is where it becomes contaminated. If you do need to touch them, perform hand hygiene immediately after. Never store your eye protection on the top of your head when not in use. We will not be going over the procedures or reprocessing for your eye protection in this module, but we do have resources, including the step-by-step poster on our website. Feel free to pause here and use the QR code to find this and other great resources if needed. Next PPE we'll discuss is gloves. Gloves may be the form of PPE that is most widely used and what most people are familiar with. Gloves create that physical barrier between our hands and infectious agents found on wounds or surfaces, in mucous membranes, spills, or blood, and can protect our hands also from harmful chemicals. Our hands are the main reason for infection transmission. Reducing the amount of infectious agents on our hands allows easier methods of hand hygiene and reduces the risk of transmission to others and ourselves. Some do's of gloves. Gloves should be treated similar to the moments of hand hygiene. They should always be changed between individuals and different tasks on the same individual. Just like our other PPE, they must fit for you, for them to work appropriately. Gloves come in a variety of sizes and also materials for those who may have allergies or sensitivities. Some don'ts of gloves. Gloves are not meant to be washed or hand sanitized. They're not meant to be worn on top of each other, meaning double gloving, as this can create small tears or rips where germs can pass either way through. Never wear gloves when you're not supposed to. They are not meant to keep you warm, and they can actually end up transferring germs to others. Gloves many times give people the Superman effect. When wearing gloves, people extend the use of the gloves, touching more things than they should because they don't feel the soilage or dirt or debris on their hands. Thus, this increases the risk of transmission to others. Hand hygiene is required before and after glove use. Gloves do not replace hand hygiene. If anything, gloves increase the use of hand hygiene. The other one we're going to speak about today is gowns. Gowns are the barrier between your arms and clothing with infectious agents that can be found from wounds, secretions, splashes, or sprays. Gowns also come in different sizes to fit the shape of your body and should be worn snugly and not like a cape. Let's go over some gowns do's and do nots. The cuff of the sleeve should be snug around the wrist, cover any watches, and when possible, gloves should go over the cuffs of the gown. There are different types of materials for gowns. It's all dependent on the amount of liquid resistance that is anticipated. Ensure your gown is tied securely so it does not come loose during the task. Only use the gown as intended and don't use other options to replace them. Gowns should not be extended past the point of use. As with gloves, they can move infectious agents to other rooms, surfaces, clients, and staff. They are single task and should be discarded or put in a dirty laundry bin to be laundered after each individual and each task. Never hang them up to reuse them on the same individual. Treat them very similarly to gloves. We have reviewed all the PPE pieces now. Facial protection is when we group mask and eye protection together. This grouping can also be referred to as droplet precaution PPE. Gloves and gowns grouped together can be referred to as contact precaution PPE. When wearing all four pieces of PPE, it is referred to as droplet and contact precautions or full PPE. Now we're going to talk about how we actually don, put on PPE, and doff, take off PPE.
So now we are going to discuss the details, steps, and practices that we aim to follow for putting on and taking off personal protective equipment. Here we'll take a look at donning. Donning is the act of putting on clean PPE before an interaction. Before starting the donning sequence, it is extremely important to ensure that all needed supplies are available. Each interaction and environment is different, so performing a point-of-care risk assessment will determine the PPE or supplies you will need. Always perform hand hygiene before touching clean PPE and take your time in order to follow the ordered steps so it is done properly. Before entering the client's environment, ensure that the quality and fit of the PPE is correct as to not expose yourself or the client to any potential infectious agents. Doffing is taking off used PPE after an interaction. Take your time with these steps as well and make sure you are doffing in the correct order, as doffing poses the greatest risk to the user. Over the next couple of slides, we will be discussing the correct order of steps for donning and doffing full PPE. If we look at contact and droplet precautions, donning for this requires the use of all four types of PPE. As we've discussed, it's important to note that the order of steps are dependent on your risk assessment, the type of interaction, which infectious agent you will be dealing with, and what you could already be wearing in terms of PPE, for example, universal masking. Gather your supplies, take your time, and follow the steps on the sign. Start with performing hand hygiene prior to touching clean PPE. Put on your gown, put on your mask, put on eye protection, and lastly, put on gloves. Doffing or removing your PPE often poses the greatest risk to the user as you have already made contact with the client and/or their environment, and now you may carry any potential infectious agents on your PPE. You must follow the steps to ensure you don't contaminate yourself in the process or spread it to other surfaces. Start with the removal of your gloves, followed by your gown. Next, you will perform hand hygiene, then remove your eye protection and mask. The final steps would include hand hygiene and replace your mask with a new one if your facility is still under universal masking. Here is a video on how to don and doff for droplet contact precautions when you're already universally masking. Step 1, keep current mask on and perform hand hygiene. You want to do this for at least 15 to 20 seconds. Step 2, put on gown. Make sure that it is secured at both the neck and waist and that both wrists are covered. Step 3, once you have ensured your gown is on securely, you can put on eye protection. Step 4, you can now put on your gloves, making sure that they cover the cuffs of the gown. You also want to make sure that the gloves are the correct size and that there are no rips or tears. Now you are ready to enter the room. After you've performed care, you will want to remove or doff your full PPE and put on a clean mask for universal masking. To remove your PPE, start with removing your gloves by pulling them down and away. Step 2, remove your gown by pulling down and away. You can do this by either untying at the neck or pulling at the collarbone to break the ties. When pulling it down and away from you, form a tiny bundle to place in the garbage. Step 3, perform hand hygiene. Since your hands were contaminated while removing your gloves and gown, hand hygiene is important as you are now going to be removing your facial protection. Step 4, remove eye protection by the sides, place in a bin for reprocessing or discard if they are disposable. Step 5, remove mask by the loops and discard. And step 6, perform hand hygiene. For the last step, you can now put on a clean mask, making sure the mask is snug around your nose and face. You have now completed donning and doffing of full PPE with universal masking. So now that we have just reviewed the correct order for donning and doffing PPE, let's try some examples of situations that you may experience in your own facilities. So for scenario 1, a client has just been placed on contact precautions after receiving a positive stool test for C. difficile. What are the necessary steps of donning PPE before entering the client's environment and doffing PPE after you have left the client's environment? Take some time, think about it, pause the module for some additional time, and then we will go ahead and take it up on the next slide. So let's take up our first scenario. For an individual placed on contact precautions, we must have the correct signage for them. On the right-hand side of the screen, we have contact precaution signage for long-term care, but the same principles concerning PPE apply to all congregate facilities. For contact precautions, minimum PPE required are gown and gloves. Our first step of the donning process would be performing hand hygiene, followed by donning your gown and then gloves. Doffing would begin with the removal of the gloves, followed by the gown. Hand hygiene is then performed, and any medical equipment that is not dedicated to the client is to be disinfected before use on another client. An example of this equipment would be a vitals machine. Our second scenario involves a client that has just been placed on contact and droplet precautions after receiving a positive PCR test for COVID-19. What are the necessary steps of donning PPE before entering the client's environment and doffing PPE once you are finished your interaction? So now for this scenario, there are a couple additional steps to the donning and doffing process, as it is not only contact precautions, but droplet precautions are initiated as well. Think back to a few slides before this where we had just gone over the donning and doffing steps. We now have a droplet contact precaution sign, and the minimum PPE required will be gown, gloves, face mask, and eye protection. For donning, the first step is to perform hand hygiene, followed by putting on a gown, mask or N95, eye protection, and then your gloves. Doffing your contact droplet PPE begins with removing your gloves, then gown. You will then do hand hygiene. This step is important before you remove the PPE from your face. Next, you would remove your mask, then eye protection, and follow that up with another hand hygiene. In our final scenario, a client has just been placed on airborne precaution for suspected pulmonary tuberculosis. What are the necessary steps of donning PPE before entering the client's environment and doffing PPE once you are finished? So for our final scenario, the primary difference in PPE and the donning and doffing process is the type of mask you will be wearing, since this is now airborne precaution. Remember that for signage, it is important that the correct signage is always in place so that staff or visitors are aware of what type of precautions the individual is on. If you look closely at the airborne precaution sign, you will see that a properly fit tested N95 respirator is required in order to enter the room. This is due to the greater risk of airborne particles and transmission as opposed to contact or droplet. For donning, the first step is to perform our hand hygiene, always essential. Next, you will put on your N95. It is important to ensure that you are fit tested with a sealed checked respirator in order to have the greatest protection against airborne particles. If you are wearing any additional PPE, you would don and doff in the same order as previously shown. However, you would just be ensuring that you are equipped with an N95 as opposed to a regular medical mask. Doffing your PPE, again, would follow the same steps. You would begin with removing your gloves, then gown if applicable. Next is hand hygiene. Then you would carefully remove your N95 by touching the elastics only. Never touch the front of your mask, whether it's an N95 or regular. And last, you guessed it, we finish the steps with one more hand hygiene. Now it is time for our recap. We hope that at the end of this education session, you now understand what PPE is and why it is important, especially within congregate settings. You can explain each type of PPE and what it is utilized for. You can confidently understand which PPE is required for additional precautions, as well as the correct steps for donning and doffing. And you understand where PPE is located within the chain of infection and how it breaks that chain. You have successfully completed Module 2 of our Back to Basics series, PPE. Please scan the QR code on the slide to view any of the other series modules available. You may also visit our IPAC Hub page, which can be found on the Thunder Bay District Health Unit website at www.tbdhu.com. Thank you all for participating, and as always, if you ever have any questions or comments relating to IPAC, you can reach out to us at our email, ipachub@tbdhu.com.